Share the screen here. And we are on. Can you guys see the screen, hopefully?
Yep, you're good, Vinny.
All right, Dr. Alm, go ahead.
Yeah, welcome everybody. My pleasure to be here to talk to you about our program. I'm the Associate Program Director for our residency program. I do sports medicine, interventional spine. Concurrently, I work as a team physician for the U.S. Olympic swim team, as well as the Kansas City Royals. With me is actually my wife, Dr. Megan Clark. She's our Cancer Rehabilitation Fellowship Director. Then we've also got Dr. Stephen Bai, who's on board with us. He's our PGY1 and one of our chief residents. Dr. Alan Tran, he's one of our PGY3s. And Dr. Vinny Francio, who is moderating our aspect from a technical standpoint. Just a quick look at who our leadership is. We have Dr. Raj Mitra, he's our chairman. Dr. Sarah Eichmeyer, she's the program director. Dr. McCasey Smith, he is the fellowship director for our Interventional Spine and Musculoskeletal Medicine Fellowship. And
me, Megan Clark, and I do the Cancer Rehab program here at the University of Kansas and our fellowship program.
I'll turn it over to Dr. Stephen Bai.
Great. So I'm Stephen Bai. Is my video feed on here?
Yes.
Yeah, it's going great.
Thank you. So I'm Stephen Bai. I am one of the chief residents for our program this year. And I'm going to tell you a little bit more about the KU program. So as a lot of you know, rehab as a specialty really came into prominence in the 40s after World War II. And the KU program was actually one of the first 5 residency programs in the US, along with a few of the other programs that you see here. Our program is an advanced program, so we do the PGY 2 through 4 years. And we do have either 1 or 2, depending on the year, spots that the IM program holds for us, for those of you who choose to do your prelim year in Kansas City as well. I won't go over too much. A lot of the details of this slide we'll get to later in the presentation, but we have a very broad exposure in both inpatient and outpatient, as well as procedural training. We usually have a medical student rotation that we're able to offer you guys, but unfortunately this year it's been mostly just KU students. So, and most of you probably know, but Kansas is really right in the middle of the country. Kansas City itself is on the border of Kansas and Missouri, and the main medical center here at KU is about 2 blocks west of state line, so just on the Kansas side of state line. And we are very proud of our sports here. So we do have Sporting Kansas City, who were the MLS Cup champs in 2013. We have the Royals, who were the World Series champs in 2015, and of course the Kansas City Chiefs, who won the Super Bowl this past year. So Kansas City itself, the city itself is actually a big part of the reason why I love this program so much. I'll be brief, but there's a lot of good food. There's a lot of unique districts that each have just very, very unique characteristics that are very close to each other. There's a video here that I think we want to show you, so I'll let you click on that, Vinny. I'm not sure if it's showing or not.
Did it work?
No, so I did not. We did not see anything, guys.
Uh-oh. Okay. Well, we can try that in later on, maybe.
That is perfectly fine. If you want to flip back to the slide, Vinny, I can just talk a little bit about it.
There you go.
Yeah. So I mean, it's in the middle of everywhere. There's a major airport where you can fly to any major city in the U.S. We again have a lot of really good sports teams here if you're into sports, and really the food scene is fantastic. So depending on what list you look at, we have 2 out of the top either 5 or 10 barbecue places in the nation, and there's a lot of districts depending on what you're kind of looking for that night or weekend. We have a more artsy district that you can go out to, one that's a little more upscale, and that would be kind of more downtown. And then there's River Market, which is more mom and pop shops and outdoor activities. So can move on to the next slide, please. Here's a photo of, actually, this was just taken a couple weeks ago. So this is our residents here in the program currently. And of course, we have Dr. Alm there in the front left, and then Dr. Sarah Eichmar, who's our program director in the front right there. Just a quick overview of the rotations that we have. So we're really quite balanced between inpatient and outpatient. We do have dedicated EMG months. We have several months of peds rehab, which is split between inpatient and outpatient. Our spine center rehab is a more general rehab clinic, and then our Indian Creek, which is our South Campus. Outpatient rotation is more focused on MSK and sports, and we have a couple different VA sites that we rotate at. On the inpatient side, we have two main services. We have one that's more stroke and general rehab focused, and one that's more TBI and SCI focused. But the other main rehab diagnoses that we see, like burns, transplants, amputees, can go to either of those services. There's a dedicated inpatient service. There's a junior attending service that you'll be on for several months, a consults rotation, and of course peds that we get inpatient exposure to as well. We just wanted to show you guys a little bit about our facility. So this is Bell Hospital, which is our main hospital here, and the glass part was more the heart hospital too. Here's Cambridge Tower on the next slide, this is pretty new. It went up, I think, about 3 or 3.5 years ago. A lot of this is neuro, and so a lot of our stroke patients will be here. And you can see in that walkway that the two hospitals are connected, so you can get anywhere walking inside. Couple of these pictures on the top right and bottom left are our new med school, which also went up about 3 years ago. And we do a lot of our didactics there, our musculoskeletal exam labs and ultrasound labs we'll do in the new part of the med school there. This is our courtyard, which is kind of central to the administrative side in the hospital here. People will come out here and eat lunch and stuff. So. And then this, of course, is our inpatient rehab unit. I don't know if we have an outdoor picture, but we're showing here is one of the nursing stations on one end of the hospital, and of course our therapy gym in the center, where a lot of our patients will do PT and OT. So it's 29 beds. It's pretty new too. So this opened in 2014. It's 29 beds, and of course it's split in between two main services like we were talking about previously. And then our consults rotation. So this is done really anywhere in the main hospital between Bell and Cambridge. It's about 800 beds. We're a level 1 trauma center, and we'll see consults for all sorts of stuff. We'll see a lot of placement consults, but also spasticity, TBI and SCI, MSK disorders, orthotic prosthetics, amputees, cancer rehab patients, all sorts of stuff for consults. And then our Indian Creek rotation. This is our South Campus. It's about 20 minutes south. And this is where our outpatient sports and MSK rotation is mostly based at. And then our spine center, this is attached to the main hospital here, where a general outpatient rotation is. You'll get a lot of procedural training, including EMGs, spasticity procedures, our TBI, CI clinic, and wheelchair P&O clinic are all here. And then we have the Kansas City VA Medical Center, where there is a lot of general rehab, but also our dedicated EMG procedures are here at the Kansas City VA. And then the EK-VA, what we call Eastern Kansas VA or Leavenworth VA, is also a general rehab clinic. Our attending out there, Dr. Kina, is an excellent teacher. You'll get a lot of procedural training out there, electrodiagnostics, but also Botox and just general MSK and general outpatient rehab. And of course, Children's Mercy. So this is where we do our peds rehab rotations. I put down here that you get 2 months of inpatient and 2 months outpatient. That is a little fluid depending on what other rotations you have, but usually we'll have a mix between outpatient and inpatient. It's about 240 beds, and it really is, it's really cool. You get to see a lot of diagnoses that you would never see anywhere else, and we have 4 months of that. And you do get 2 weeks of elective rotations in your PGY3 as well as PGY4 years if you choose to do that. Typically they're within the KU system, but you can choose to be outside too. And we did want to mention a little bit about mentorship. So as a PGY2, you are paired up with a faculty advisor, and typically it depends on your interest. So it'll be someone that has mutual interest. For me, I was more general rehab, I didn't really know what I wanted to do. So I was paired up with a general physiatrist. But for example, if you know you want to do sports or spine medicine, Dr. Ulm would be there for you. Or if you wanted to do cancer rehab, Dr. Clark would be a good mentor for you. As far as procedures go, I actually do honestly feel this is a very strong part of our program. So we get dedicated EMG nerve conduction months, dedicated rotations for that, but also on the gen rehab rotation and also on some of the other VA rotations, you'll get EMGs. So the minimum requirement is 200. I think our average when we looked at it was our residents were getting at least 250 that they were logging. And if you're anything like me, I forget to log like half of mine. So probably more than that in reality. You get Botox. We do a lot of ultrasound. We do intrathecal vacuum pump management. Spine procedures, we get a ton of. We have a fellowship here for interventional spine. And so the ACGM requirements for that are quite low. But I mean, I think just with you, Dr. Ulm, I think I've done 70 or 80 that I've logged. And I've done, interlaminars, transforaminals, facets, MBBs, SIs. I've done pretty much everything as a resident, so that's pretty cool. And then, of course, other MSK procedures. As far as research goes, the requirement for our program is pretty much the bare minimum that ACGME requires you to do, which is just do something, just present something throughout your 3 years. And I'll say most of our residents do a lot more than that, and we have a lot of faculty mentors that are there for you, depending on your research interest. Next slide, please. And we do have, so if you look at NIH funding, we're one of the top 10 ranked programs in the nation for PM&R programs. Our NIH funded professors are here. So we have 1 clinician scientist and 3 basic science researchers. We also have almost all of our faculty do clinical research that you can get involved in, even if it's not NIH funded. As far as didactics go, so we do it on 12-month blocks. It's usually Thursday mornings from 7:30 to noon. And in addition to your classic lectures, we do a lot of exam workshops. We do ultrasound labs, as you see there on the top right. And then on the bottom right, rather, is our wet cadaver lab. Dr. Enders, who's our anatomy professor here at the School of Medicine, will get us in there and teach us anatomy on the cadavers as well. And we're showing here where one of our lecture rooms is. And of course, this is one of our ultrasound workshops. This was actually just a few weeks ago. And I think you put this slide together, Dr. Francio. And it looks like you have Dr. Tran and Murphy, some of our more fit residents there, and not me. And I will remember that when I'm your senior on rotation. So benefits, I'll briefly go over this. So you do get 15 days of vacation. You get 10 sick days and 5 conference days. You get conference paid for if you have a presentation. But you can find this on our website, so we can skip to the next slide here. Call schedule is something that I do want to stress. So at least when I was interviewing as an MS for this, I can't speak for all the other programs, but KU has one of the most chill call schedules that I personally interviewed with. So it's home call. It's a week at a time. You're taking call from 5 p.m. to 7 a.m. during the week, and then you going around on the patients and cover during the weekend as well. So your 2-year, I think I gave you guys all 7 this year, Vinny. Your PGY 3-year, you get 5 weeks, and this year for me, I have 2 weeks of real call, and then 1 buddy call, which I'll be kind of there for backup, and as a second call for one of the PGY2s during their first call. So, I mean, I have 50 weekends out of the year this year off. So, and we kind of just wanted to, I've talked a lot. The PGY 4-year is a lot of outpatient and procedure focused, but I'll let Dr. Tran and Dr. Francio here talk about what the PGY 3 and 2 years are like.
Yeah, so I'll let Dr. Francio talk about a day in the life because it's a little more consistent with inpatient. With outpatient, which I'm on right now, it's kind of variable depending on the rotation you're on, but just the short and sweet of it is that you do get a broad exposure to everything. Some of it depends on what day and what clinic you're on because you kind of rotate in between. But I'll talk about why I chose KU PM&R and what kind of drew me to it. So What attracted me to KU PM&R, I kind of break it down as a medical student to logistically,
You guys have 5 minutes.
logistically, goal-wise, and then just wellness. So like logistically, and it's hard to grasp this as a medical student, but like Steven mentioned, the call schedule really is good. Like 7 times out of the entire year, I'm on call right now, and it's not bad at all. And then you have the rehab hospital with the main hospital directly feeding. So it's not like a standalone. So it's not like you're driving to the rehab hospital from another location. All the facilities are new. And so logistically, it's hard to grasp that as a medical student, but those things really do matter as a resident, just for your sanity. And then for goal-wise, I feel like we're set up kind of just for whatever your future endeavors are. Like the program really is tailored to whatever your career goals and needs are. If you're really academic, you want to pump out research publications, we have the research track. We've had that done. Steven mentioned we have the NIH funding. If you want to pursue fellowship, we have fellowships in-house. We prepare you for that. Even for fellowships that are not offered here, we get you prepared for that. And then if you just want to learn the skills of your job, live your life, and be prepared for work, we get you ready with the procedures from Botox to peripheral joint injections to EMG. I'm on EMG rotation right now, and you go well over the number needed for ACGME. And then honestly, like whatever your desire or effort level is, we have support every step of the way to get you where you want. And then for wellness wise, I would say Kansas City, again, central location, easy access anywhere. I'm a big traveler. Some weekends when I'm off, and I have a lot of weekends off because we're only on call like 5 to 7 times. Before COVID, I would just take a trip somewhere because the flights are really cheap and just go somewhere for a weekend. You have a city that is small enough where the traffic is not bad at all, but big enough where there's a lot of things to do. Obviously, major sports. We win a Super Bowl. Super Bowl is like really good for a city, bringing in attractions, events, things like that. So it's just it's a blast. Lots of things to do. I'm a pretty social person. I'd say I have no problem balancing work life, going out, and working out and doing things that I want to do outside of work too. So also I did my internship. I was actually fortunate enough to do my internship in town. It wasn't at KU, so there are options for other programs. And so I've met a lot of people along the way doing internship here at a neighboring program for internal medicine. And so it's just fun. So, yep.
Thanks, Alan. Yeah, so as a PGYHU, we spent 6 months in the inpatient unit, and it's great. We have beautiful facilities. We have great therapists. I think Jim is wonderful. I think we had exposure to the bread and butter of PM&R, and as well as great cases that it's very interesting to learn and kind of do your own research later on. So why I chose KU PM&R, really, I think Stephen, Alan, and Dr. Alm already mentioned the reasons why. It's just a wonderful program, great location, and gives you all the support that you want to be a well-rounded physiatrist. So for sake of time, I'm going to go ahead and run it back to Stephen.
You guys have 2 minutes.
Great. So in the interest of time, Dr. Francio, can you skip forward to the slides about, we do have sidelining exposure really quick. There's Dr. Alm working with the Olympic sports team there. He's one of the team physicians there, but let's skip towards the fellowships. I just want to mention that really quick. So we do have a PEDS fellowship here. It's a 2-year fellowship through Children's Mercy. We also have a MSK and Spine fellowship here. That's a 1-year fellowship. That's through the program. And then we have a Cancer Rehab fellowship. Dr. Megan Clark's our fellowship director there. And if you're interested in all on cancer rehab, we have one of the few cancer rehab fellowships in the nation. So, and then these are other fellowships that some of our residents will apply to that are through some of the other programs. Let's open it up to some questions.
Looks like we have a question for Anthony. Anybody want to answer there?
So soccer coverage is a little bit different. Like most sports medicine, it depends on your contracts. Actually, one of my friends from residency, he is fellowship at Stanford. He works for one of the private practice groups in town. They've got the contract for Sporting KC. He has taken our residents with him on games in the past. So that's certainly an opportunity if people are interested in doing so.
Thank you, Dr. Alm. So I would encourage all the residents from our program here to put your email in the chat box. I'm doing that with my email right now. So if you have any additional questions about our program, you can send us an email. We are also trying to plan additional sessions with a meet and greet with our residents and directly questions, a Q&A about our program. So stay tuned for that. Please give us a follow on our Twitter page, KU_PM&R. And if you have any additional questions, emails as well.
Awesome. Well done, guys.